Hi, my name's Reece. I'm from Burnet Institute, and today I'll be talking about COVID-19 and tobacco smoking. The co-authors are listed on screen here. And before we begin, the disclosures. Tobacco use is a leading cause of preventable morbidity and mortality globally, and daily smoking has declined to 11% of the Australian population, and this reflects our world-renowned approach to tobacco control. However, high levels of smoking amongst population subgroups, such as people who use illicit substances, remains an ongoing major concern. Although it is not clear whether smoking is a risk factor for COVID-19 acquisition, it has been associated with increased disease severity and mortality, and it was thought the impact of restrictions would increase smoking rates. In this study, we illustrate changes in smoking prevalence and patterns pre and post COVID-19 restrictions in two prospective cohorts of people who use drugs to examine possible opportunities to reduce smoking-related harms in the context of the COVID-19 pandemic. So in SuperMix, all participants injected drugs at recruitment. Participants are interviewed annually and daily smokers are asked the question on screen. In VMAX, participants all smoked or injected methamphetamine at recruitment. Participants are interviewed biannually and asked the questions on screen here. We used repeated measures analysis of responses to these questions pre and post COVID-19. The dates are listed here on screen, and we used the participants' most recent interview only. We found no increases and small but statistically significant changes in both smoking prevalence and consumption in both cohorts after COVID-19. So this was days in VMAX and cigarettes per day in SuperMix. So these reductions highlight how smoking can change in these groups of people who use drugs. However, reasons for change remain unknown. The decline suggests that supporting smoking reductions and pathways to smoking cessation among these groups of Australians is worthwhile and may produce positive health benefits and reductions in COVID-19 disease severity. For this reason, we recommend all available strategies for smoking cessation be incorporated into drug treatment services, particularly as there will be ongoing disruptions to health services during this pandemic. Proactive, personalised and tailored strategies have shown to improve recruitment to smoking cessation programs, and the use of the supported callback service provided by Quitline may be of benefit here in Australia. Despite the ongoing COVID-19 pandemic, support for quitting smoking for people who use drugs may not only result in the usual health benefits of quitting, but may also reduce the risk of COVID-19 related consequences. And finally, we need further evidence to determine the drivers of the behavioural change.